Dr. Mukashin, and we also have 2 hospital-based pharmacists who serve as preceptors. It's an internal medicine rotation that I precept, and the students are assigned medical teams similar to the ones that you heard from Dr. Rudolph. Rounds start early in the morning. We do 3 rounds around 7 o'clock. They go in rounds at 8. There's around 20 patients per team. Each student is placed on a separate team. They round with the medical residents and also the interns and other house staff such as attending physicians and hospitalists. We're involved in medication reconciliation. We probably will be starting a discharge planning. We also get involved with P&T reviews. We do drug consults almost daily for the physicians. My students also do in-services, and sometimes they present at 12-room conference to the health staff. And they gain a lot of valuable confidence and experience by just following patients on a day-to-day basis. They usually soak up patients as needed and determine clinical drug interactions with me in the morning. I go over some of the interactions before they go on rounds. So they develop a little bit of confidence also talking it over with me first. And then they come back and tell me what the follow-up was. I do round with the students every day, but because each one is on a different team, I round every other day with the students. But I am always available for help. Also, they do, besides that, they write drug consults. They also write written papers, and they do a final PowerPoint presentation to the pharmacy staff. They also do journal club, and today we had a journal club with the entire house staff, so that was sort of interesting. And I think you'll like it. If you know anybody who has done my rotation, please talk with them. I'm always available. I may not be able to stay for the end here, but my office is W342, and I really look forward to seeing some of you on rotation.
All right, how's it going, guys? All right, so by now you should all know me. I'm Dr. Zimmerman. I'm one of your newer faculty members here at the college. My rotation satisfies your ambulatory care requirement. It does have a geriatric overtone, so all of the patients that we will be seeing will be geriatric patients. My practice site is down in Brockton, VA, so it is a little bit of a commute for those of you who live in the city. There is no good way to get to the Brockton site by public transportation, so you would need to carpool or have a car accessible in order to get there. The VA is a great practice site. You have medical records that are all computerized, physician order entry, everything is electronic, so it makes it really easy to get patient information, and I think sort of expedites the learning curve a little bit. The clinics themselves, we have 2 different clinics. One is a geriatric primary care clinic. We do thorough medication reviews on all of the patients that we see prior to their primary care physician visits. You also get the opportunity to sit in on those primary care physician visits, so you get to see the physician-patient interaction, learn some of the nuances of physical assessment that maybe you might not get in PA lab this year. Tonight, here's heart sounds, some interesting things. The other clinic where we work is an interdisciplinary memory-based clinic, so we see patients who have a variety of different memory disorders other than Alzheimer's disease or other geriatric syndromes. They're complicated patients to manage, but they're also very rewarding patient population to treat. In that clinic, we work with physicians. We have an attending physician, a nurse practitioner, we have geriatric fellows from the Harvard Geriatric Fellowship Program. We have neuropsychologists, social workers, and we also have social work interns and nurse practitioner students. So it's a very interdisciplinary clinic. You'll see a lot of really cool things you wouldn't see elsewhere within primary care. There are a number of projects with the rotation, a number of written and oral presentations. We do a journal club, to everyone's dismay, I'm sure. And let's see, we also do a few outreach programs. We also will do, depending on the time of year in the semester, have some teaching opportunities. You folks will, in the fall time, be helping out with seminar. In the spring, be helping out with PA lab and pre-lab. As you folks know, you've seen some of our students rotating through. Especially with on behalf of Dr. Schnee. He was supposed to be here tonight. He apologized that he couldn't make it. A little brief overview of Dr. Schnee's rotation. Dr. Schnee's practice site is right down the street at the VA in Jamaica Plain, right on the corner of Key Street. So very easy to get to from here. He also, works with VA patients. They're all different ages. So where I treat only geriatric patients, he sees patients of all different age groups within the VA for a number of different primary care disease states, mostly diabetes, hypertension, lipids. The big table of you have to do a 50-page paper for Dr. Che's rotation is not true, so everyone can read easy. His rotation is challenging, just like all of our rotations within the VA are challenging, but you will get a lot out of it. He does a lot of teaching, as you guys know. You'll be following him to seminar, helping out with seminar. His students also help out with PA pre-lab. He does a number of community outreach events, usually in the North Shore area primarily. Let's see what else. I think that's pretty much the big nutshell. He has a few different projects he'll have you do. He'll do a bunch of disease state topic reviews as well. So if you have any questions about my rotation, Dr. Schnee's rotation, or Dr. Patel's rotation, who I understand is also not here this evening, he's also down at the Brockton PA. His rotation is different from mine. But if you have questions about any of those three, I'd be happy to answer them for you, okay? Thanks, guys.
Hi, I'm Dr. Cheng. I think by now you guys all know me, and most of you probably remember that last semester during therapeutics I told you that my practice site is at Brigham and Women's Hospital. So if you have no problem coming to school in the last 5 years, you shouldn't have a problem going to Brigham, so no transportation problem at all. My area of practice is cardiology. There are actually quite a number of cardiovascular disease pharmacists, clinical pharmacists over at the hospital, so we all kind of subspecialize to a certain degree. My surface is with the heart failure surface. So the patients that you're going to see will have a variety of different heart diseases, but mostly it's going to be decompensated heart failure, cardiogenic shock, and arrhythmia. So that's that's going to be my surface. So if you don't like cardiovascular disease, that's not a good place. Anyway, just want to talk a little bit about Brigham as well. Besides myself, there is 2 other faculty members there, which you might hear some of them speak tonight. But there are also a lot of adjunct preceptors over at Brigham. I would say, for every block, there would probably be anywhere from 10 to 15 NCP students over at the Brigham at every block of rotations working with different preceptors besides myself. So the one thing is, it's kind of like a little small families that you guys have among yourself over at the Brigham. There's a lot of good support and you can work with each other. We all try to get our students to sit in each other's presentation as much as you can. So even though you might be doing cardiovascular disease, you can get exposed to a variety of different things, depends on what your friends are doing. Regarding my rotations, I offer 2 different types of rotation. When you're coming to the time when you pick your choices, I'll be listed under internal medicine / cardiology. So it will satisfy your internal medicine rotation requirements, but it will be really, I have to say, 90% cardiovascular diseases. You're going to see some infections and affiliated comorbidities, with the patient that are, a variety of internal medicine issues, but it's going to be primarily their chief complaint is cardiovascular. Like any other clinical rotations, I guess different rotations at Brigham starts at different time. We start our round at 8:30. Students come in anywhere between, 7:30 to 8 o'clock to do pre-rounds and look through the patient information before we meet the team for a round. They love pharmacy students. They're so used to having so many of them on so many different surfaces now. It actually looks weird when there's a block off that there's no pharmacy students there. So the physicians there, nurses are, very, it's a lot of fun to work with. It shouldn't be very intimidating. Hopefully, will be hard work, with a lot of good learning. Rounds are in the morning, start at 8:30, finish anywhere from 10:30 to 12. Really depends on how busy the service is. In the afternoon, several times a week, we sit down again with students and go over patients in more detail. Some of the times we'll be doing journal clubs, presentations, talking about different disease state topics. topics as well. So, and you might have a lot of things to follow up on your patients, you know, with problems and questions that are given to you in the morning that you might have to work on and get back to your team in the afternoon or the next day. Second type of rotations that will be listed under my name when you come to choose rotation is cardiology elective. That, in terms of structure, is very variable based on, you know, who you are and, you know, I guess what time of the year that you come for the elective rotation. If you are interested in research, that's a good rotation, you know, to actually spend more time working on projects. There's always things to go on. If you are particularly interested in cardiovascular disease and you just want to get exposed more clinically, absolutely, you know, we'll do another more focused cardiovascular disease rotation. So I think I'm being cut off, but that's it. You know, if you have any questions, feel free to email me anytime. Thank you.